Okay, welcome everyone. We have another episode of Demystifying Medicine podcast. Today I will be your host, Cynthia. With me is
Harini?
Shella.
Edison Jolie.
Today's topic is going to be healthcare burnout. And it's a very, very interesting topic, very, very heavy. So just bear with us. I saw this Reddit post this morning. It talked about a 50-year-old man's anxiety and worry about getting sick. He feels like he can't or he won't be able to get the care that he needs in the climate of our healthcare system right now. What do you guys think about that? Like, what do you think is the reason? Like, he's 50, like he should not have to worry about all this, especially like we live in Canada. Like, what do you guys think?
Yeah, I think, like you said, having this concern in like a first world country with universal health care, it is a bit interesting. Like, why would he have this concern?
Yeah, like on social media, I've seen multiple different posts, like from various different people trying to get help, like these long ER wait times, having to reschedule their appointments, not even being able to find a family physician, but then also workers just being so done with the current state of things in the healthcare system.
Yeah, like relating to that, I think I saw a TikTok of like this nurse. She was just talking about her experience of how she's so like burnt out and just tired of these long working hours. So I do think that it has something to do with that for sure.
Wait, Harini, I think we were talking about burnout the other day. Like, tell us more. I think you have more
Yeah, so
information on that.
burnout itself, I believe, is characterized by three different attributes. So it includes mental exhaustion, depersonalization, as well as a decreased sense of personal accomplishment. And together, when an individual is feeling these three different things, it can lead to burnout, essentially.
What do these terms mean? Depersonalization?
Yeah, so like to start with depersonalization, as you pointed out, it's essentially when a healthcare worker might become unfeeling in response to others. And that just might be a coping mechanism where they start forming a sense of detachment, both for patients as well as other healthcare providers. So to provide an example of this, say there's a middle-aged man who's been hospitalized because of a massive upper gastrointestinal bleed, essentially a gut bleed. The healthcare worker who might be experiencing burnout might, as a coping mechanism, start referring to him as the bleeder. But referring to the patient as the bleeder, you're taking away that sense of individualism and like the humanity portion of this patient away.
So they basically label the patient as the illness.
Yeah, essentially, which is really unfortunate. But then you have to look from the healthcare's perspective side. When you're facing so many patients, especially in COVID and the sick wards, when you're facing so many patients, it might just be a way to distance yourself from what's happening.
Yeah, but that still isn't, it's not nice.
Yeah, I do feel bad for the patients.
Yeah.
And that's tied into like the emotional exhaustion side of burnout, which is another component, and the sense of feeling overworked and overextended and like having nothing left to give, which may be factoring into why depersonalization itself is arising in the healthcare system. And then that together from both emotional exhaustion as well as depersonalization leads into the third attribute of like the decreased sense of personal accomplishment. So healthcare workers, especially with COVID and the high mortality rates, might have been feeling incompetent, inefficient, and unable to complete tasks as they don't see the impact of their actions helping patients in these wards.
Wait, are there any signs that like people can look out for? Are there any like stages of like burnout? Or do you just wake up one day and say, I'm burnt out?
Yeah, so there are stages and there are signs. To just go over signs really briefly, I believe a couple of them include anxiety, depression, just frustration of working long hours. Also, fatigue is it's normal to experience fatigue, but when this fatigue becomes permanent and chronic, then that's also a sign of burnout. Also as insomnia, so you're not able to get sleep anymore, or you have trouble falling asleep. That's another really key feature or standout of burnout. And burnout itself has 13 stages. So you don't wake up one day realizing you have burnout. It's like a gradual progression that leads to the state of burnout. And so like to just quickly go over them, it's a compulsion to prove oneself, and then it's starting to work harder because of this need to prove oneself. And when you start working harder, you then start to neglect your own needs. And then this, because you're neglecting your needs, that could lead to a displacement of conflict. So you're like you have a need to like prioritize yourself, but you also have the need to prioritize your patients, and that's conflicting one another. And then again, this might then lead to a revision of values because your values aren't aligning. So you have to do something about this. And then you're denying when problems are arising because you're trying to ignore them, trying to face them. It's a coping mechanism. And then that might lead to withdrawal. So you're kind of just taking yourself or the personalization aspect out from the situation. And then that could lead to behavioral changes, compassion fatigue, as we touched upon earlier, and the depersonalization, also touched upon earlier. And then the
Wait,
inner
Harini,
emptiness.
Harini, like they sound like multiple steps. Can some steps happen together? Or like, can some people like skip steps?
Yeah, so this isn't a hard and fast rule. It's just 13 different stages that have been observed when the study was observing different individuals with burnout. There's no real strict hard and fast rule of this is how a person is going to experience burnout. It's very personalized to the individual itself. And there's also different severity levels, you could say.
And do you know roughly like how long burnout will like attack a person? Lack of better words, obviously.
Yeah, so burnout again, it's a gradual process. I think everyone's timeline is different. It's just like everyone has a different plate you could think of how much they're able to take on. So depending on that individual and that size of that plate for that specific individual, it's going to be a different timeline. So what you really want to be looking out for are those signs that we just mentioned earlier. And that's what you really want to keep an eye out for. Doing those emotional checks on yourself and those around you to make sure that they're doing all right.
That sounds pretty
Now
good.
that you say all of this, I think I remember like seeing a study that was conducted in 2018. So this is before the pandemic even happened. And it was, I think, 19,000 nurses. And they found that these symptoms or like these stages of burnout that you mentioned, so like depersonalization, they found that it was as high as 12.6%, and emotional exhaustion was like 34%, and a lack of personal accomplishment was like 15%. So I can only imagine if this was the state with nurses before the pandemic, how much it must have been amplified and exacerbated after the pandemic started.
To give a little recap of what we talked about, here's a little summary slide that you can pause to read.
I think it's really interesting, the fact that Shella brought up COVID. We all know COVID basically exacerbated all the previous problems we had in the healthcare system, but what exactly does that look like?
Yeah,
Cedric,
there's
I think you have a couple of notes on that.
of course. So yeah, there's like a lot of turnover, like a lot of people are quitting, which is totally understandable because the pressure is a lot for like nurses and any healthcare worker at this point. So I did come across like the Registered Nurses Association of Ontario report. And even before COVID, let's just look at that. Like the pressure was already there. So after, like during and after COVID, more than like 75% of nurses were classified as burnt out, which is more than pretty much 3/4 of the nurses there. And 73% of them reported that their workload has increased significantly during the pandemic as well. It's like, what do you guys think?
Yeah, I think
that's so sad.
obviously, yeah, their hours have increased drastically. I think I was reading up on this and it said like the year before the pandemic started in 2019, April, they were working about 6.6 overtime hours, which is still a lot. And then afterwards, during the pandemic, April of 2020, it jumped to 9.7 hours. And there was like a more significant jump in the months following. So it just gotten worse and worse. Some nurses are working over 80 hours a week.
That's like double. Is that 80? Like, did I hear that correctly? 80?
80 hours a week. That's crazy. And then obviously, like during the pandemic, you've got patients who are sicker and like they require more demanding care, which is obviously exhausting for the nurses themselves. And they're having these shorter hospital stays, but they're just so much more intense. And in addition to all of like the work, it's like you have so much psychological and mental stress. You don't want to bring home the virus to your kids, to your family. And as a result, a lot of nurses, they didn't even go back home. They'd stay in a hotel so that they weren't like affecting their family. And on top of all the social isolation, social distancing you're already having to do, like imagine how like you're not even
You
seeing
lost
your
your support
family.
system, is what you're basically saying. Like, you had no
Yeah,
support to get through this.
yeah, absolutely.
I think
And
you made a good point about the extra workload. I think I read somewhere that it's not just nurses who are impacted, it's other like healthcare staff, right? I know that I saw this one, I think it's a post somewhere. Somebody said that because housekeeping staff were like slowly leaving and they were also short staffed, nurses had to take on some of the housekeeping roles, like taking out the trash, taking out the linen. in addition to all the stuff that they already do. And I was like, that's crazy. They're doing like 2 people's work for 1 person's salary. Like that's unbelievable. Also, I also saw somewhere else that because there are short staff, a lot of hospitals have started introducing like baby nurses and medical students like prematurely into the workforce. What do you guys think about that? Are you comfortable with a 3rd-year nursing student giving you your medication?
Absolutely not. Just put that out there. But like I get what they're trying to do. It's because they're trying to like bring in people that are somewhat experienced. But like, can we really like we gotta train properly before
think-
like
If anything, like obviously this was like a carefully vetted decision when they decided to bring in the 3rd-year nursing students and medical students. Like they always obviously a lot of thought, there was a shortage, they had like reasons behind it. But I think the challenge is, or the concern is, are they being adequately trained? Are they adequately prepared? Or is it just a response to the challenging times? And defining that is like kind of obscure. So it's very subjective, or like there aren't objective measures yet in place, which is what part of the issue is. And that kind of leads me to like this point where a reason why they might have to be bringing in these baby nurses is just because of all the ethical and moral distress, you could say, that these healthcare workers are on. There was this one quote that I read that really stood out to me. It really, I don't know, it left an impact, and I just want to read it out to you guys if that's all right. So it was an emergency room nurse who was working in New York, and this is what she had to say about it. So she was saying, nurses working 60 hours a week with bruises on the bridges of their noses from the respirator mask, doctors shedding tears as they informed the staff about the difficult decisions that will be made in the coming weeks about who to resuscitate because we just don't have enough ventilators, environmental services teams environmental services teams scrubbing and scrubbing isolation rooms, all of us fielding phone calls from terrified family members who aren't allowed in the hospital, and then coming around the corner to find that one of your do not resuscitate patients had passed, and then alone. So while I and everyone else were too busy to be by this patient's side, I have to now live with the guilt that I couldn't honor her and her family by being beside her. And she was specifically going on to say how she didn't sign up for this and how it's just a simple catastrophe. And so the issue with this is that under the International Code of Ethics, it states that within nursing, there's a respect for human rights, including cultural rights, as well as the right to life and choice, as well as the dignity to be treated with respect. But because of this like absurd situation caused by COVID, where you didn't have enough equipment, you weren't able to connect them with their family and loved ones, and all these different issues that she was talking about in this quote, it just wasn't possible. So now you have a conflict with your morals within the profession itself. And that's very specific to nursing, but it's quite universal right now in the healthcare system.
And I think it really goes back to Harini, the component of burnout you were talking at the beginning, lack of personal accomplishment. Like these nurses have signed on to this profession to help save lives, but at this point they're seeing more deaths and loss than they are seeing life in general. And then also like patient care, like that's a huge part of their job, but for them not to even have the time because they're so overworked and understaffed to just like
and being able, having the knowledge to be able to help them, but just simply not being able to because they don't have the equipment or the staff.
Yeah.
Like I could imagine how frustrating that is to see.
Can you guys imagine the guilt? Oh, that's so much guilt. Oh my god. But I'm gonna change the topic a little bit. I know that a lot of nurses, because of that guilt and because all that stress, they are choosing to leave. I know there's been an increase in things like travel nursing. I know they pay better, but why can't the government just pay normal nurses the same fee as travel nurses? Like where's that discrepancy? Do you guys have any ideas?
Well, I know in Ontario in 2019, the Ford government introduced and passed Bill 124. Are you guys familiar with that?
Oh, yes. So Bill 124 is introduced by the Ford government. I don't know how you feel about that, but it's a wage suppression legislation. So basically it caps how much, I guess, salary wages can increase to 1% a year, which is absolutely nothing. It's a couple cents. It's crazy. Anyway, it also is a contradiction to the ONA members' Charter of Rights to freely bargain. I know Shala, you were talking about it. Can you explain more?
Yeah, so of course, as you mentioned, like through this bill, for 3 years, starting in 2019, the wage increase has been limited to a maximum of 1% of total compensation. So as a result, the Ontario Nursing Association that typically helps negotiate for the unionized nurses for wage increases, they're very limited. What more than can they do if they're capped at 1%? What are they even negotiating for? So I believe in September of this year, they actually took the case to the Ontario Superior Court, where they argued that this bill is in violation of constitutional rights, such as the right to freely bargain, which was introduced by the notwithstanding clause and is a part of our constitution. And moreover, not just that, they also mentioned how it's interesting that this bill applies to a lot of public sector professions, such as nurses and teachers, but most of these are women dominated. And police workers and firefighters that are male dominated professions are not like encompassed by this bill.
Wait. Say that again. What? What?
I'm sure you know that, or maybe you don't, but 79% of all of the workers that are impacted by this bill, Bill 124, they're women. And 82.6% of all healthcare workers are women, which are the ones who are being affected by it. So that really poses a huge question on whether the bill is constitutional, because it's obviously invoking some sort of gender discrimination.
Like past constitution, like yeah, all you brought up was like really important points. But the fact that nurses and like healthcare workers and nurse practitioners and all those that are encapsulated by this bill, they've been putting these obscene hours and obscene effort to like ensuring that our healthcare system essentially doesn't sink and like not even being entitled to a wage increase to like not just like recognize but like thank them for all that they're doing right now. It's like absurd.
Literally crazy. But also, you said it's been 3 years now.
Yeah, isn't it supposed to expire like this year?
Yeah, so basically they took it to the Ontario Superior Court in September, and now we're waiting on a decision. But a lot of people have been asking why. Like it's about to expire soon, and we're going to be over with it.
Yeah, I was gonna ask that. Like, why are we even caring about it? If it expires, then it's no longer there, and we're all back to normal. No.
That's a good question. But the thing is, if this bill isn't repealed or if it's not deemed as unconstitutional, it'll simply expire and that's it. These workers will have lost out on the wages. However, if it is repealed or if it is deemed as unconstitutional, the nurses and the other unionized workers and ununionized workers that this bill has applied to will be able to go and argue for retroactive wage increases.
Yeah, wait. I just want to clarify what exactly are retroactive payments or wages?
Yeah. So basically, all the hours they've already worked and they haven't been paid for. I mean, they haven't paid, but not the amount that they should have been paid. If this bill is deemed unconstitutional, they can receive that money now after the fact.
Okay, so they're getting paid for hours they've already done, but like in the present now.
Yeah.
Get that money, honey. Okay.
So, yeah, as we're waiting for this as we're waiting for this decision by the Superior Court, we also need to be signing petitions, because even if the Superior Court, like we don't have to wait for that decision. If the Ford government decides to repeal it, they can do that.
Let's support our healthcare workers.
Yes. Seriously. Okay.
Get them the compensation they deserve.
Again, feel free to pause on this slide. It just summarizes the last 10 minutes of conversation we just had.
So we just went over like the various different contributing factors to like why burnout is so prevalent in COVID-19. And like we know, we've just seen and heard about the absurd amount of like nurses and like healthcare workers facing it. But like how does this translate? How does it impact us on like a societal level?
Well, I saw a post that was from a physician that said, patients often hate us. They don't trust us. They don't listen. They treat us like we're a customer service industry. I thought that was really harsh, but what do you guys think about it?
It also hurts a little bit to hear that that's how they feel.
Yeah.
Yeah. Like I can see how that would feel, like that would come across as harsh, but like wouldn't you guys be a little frustrated like if you had to wait like 8 hours to like be seen when you're in like pain? Because like I know like if we often like take a look at the topic of burnout through the perspective of healthcare workers themselves, but it is inevitable that patients are also affected by this issue, because patients often feel as if their health is threatened if the provider is not fully conscious or active while working, because it could increase like the risk of medical errors, right? So like imagining yourself being in the patient's shoes, and maybe you have been there before, but patients like are often like unwilling to receive care at that point. And I found this like article, I think it was like by Tabor et al, and they basically found that like 39% of patients like avoided going to the doctors due to previous like unfortunate experiences with their like provider.
Yeah, this reminds me of the initial post about the 50-year-old. It's really, really sad. But I just wanted to talk about like ERs are also closing. So like even if those people wanted to go to the ER, like they're all closed. Like what do we do about that?
Yeah, I saw, I think I read up on this and they were talking about how in Ontario, just the past summer, so 2022, they saw their emergency departments close in hospitals over 80 times, and basically culminating into like 1,700 hours where people needing urgent emergency care weren't able to get it.
Can you imagine if that was like your loved one, like just being like going to the hospital, like you see them as like a place, like hope, and then not being able to receive that care?
I know.
And like time is such a sensitive issue in these
I
cases.
know, but even if they go to the ER, there are people waiting like 8, 10, 12, 24 hours. There's another person that said, I spent 8 hours pacing in the ER room with a kidney stone. I was literally vomiting into a bag because I couldn't take the pain. There was barely any staff around. It's like the reality. It's the reality of everything. But also I was thinking about it and I was like, okay, some ERs are closing, some ERs are packed full with long waiting times. Like why is this? And I saw a article in the Global News. It said that at least 15% of PEI residents don't have a family doctor. And I was like, oh, like that could easily be part of Ontario too. Like, do you know how many Ontario residents don't have family doctors?
Yeah, like I was looking at the Ontario Family Physicians website, and it was saying like how like in 3 years, like 1 in 5 Ontarians could be without a family doctor, which is insane.
That's
And that would only like increase the burden on the ER departments because if you're
Yeah.
not family doctors go, where do you go? To the hospital.
Right? But family doctors themselves also have like long wait times and very, very short appointments. So I saw this other person that said, I've been waiting over a month to see the doctor, but they only gave me 10 minutes. And then another person responded to that post and said, my general practitioner has a sign in their office that says maximum of 2 problems can be discussed in your 15-minute appointment.
Imagine, but like having so many patients that you have to put like some kind of stipulation like that. But then now you're putting also the patient, they have to choose like what are my 2 most pressing issues? And like if you don't have like adequate medical knowledge, how do you even know which 2 to choose to bring up?
Yeah.
I think it's just a huge domino effect, and there's really no clear solution.
Look at
But
no one.
like just to add on top of that, there's also a lot of surgeries that have been canceled. And it's really, really sad because people are actually dying from these, like these surgeries being postponed.
It's like a no-win situation because it's not necessarily the patient's fault, but it's not also the healthcare worker's fault. It's just like the system is failing.
Yeah.
But like, let's talk about physicians now. I know we talked about patients. Physicians, we talked a little bit about nursing and how some nurses are switching to travel nursing. But is there such thing as travel doctors? Travel physicians? I personally don't know anything about that. But I just wanted to ask, like, what are physicians doing to cope with like the pandemic and burnout and all that?
I would love to touch upon that, but it's like it's such a big aspect of like why it is the way it is right now. So like the cost to the physicians and like to the healthcare system can be enormous because physician burnout is associated with increased rates of depression, alcohol, drug abuse, divorce, suicide, like medical errors, and you could keep going with this. And the cost of this is that it has a cost to the healthcare system as a result. So like for example, physician, not even a high turnover rate only, but like appliances, medical errors, lawsuits, like it has a huge cost. And there's this article published saying that working towards forming solutions would be a less costly, I guess, endeavor than dealing with the repercussions of burnout. And it's also better for the workers. You would have a lower turnover rate. It would be a better like working environment. It would be more patient satisfaction. It has a better rate. So just something to keep in mind.
Yeah, and like Harini, I think you talked about like the alcohol rates and like suicide, and like even like I came across like the National Academy of Medicine, and they looked at several like cross-sectional studies, and they found that physicians have like 25% increased odds of like alcohol abuse and dependence, and also increased odds of suicide as well, which is upsetting.
Suicide or suicide ideation? It's like the wishing.
Sorry?
Is it like actual suicide or is it like
It's like them thinking about it. They're not like actually like taking action, but it's like the process is like there, you know, the first step of that. They're like thinking about it mentally. But it doesn't necessarily mean that they act on it, but it's still there.
It's still a big warning sign.
Exactly.
Now, with all of this talk on burnout affecting physicians, nurses, other healthcare workers, like, is there anything that we can do? Like, what can we do?
I think when you're looking at it from like like an individual perspective, if you're a physician, if you're in the working in the healthcare service industry, like make your concerns known to your supervisor. I know it's an impossible situation, but just being cognizant, self-aware, and vigilant about the potential for burnout, and if you're experiencing it, seeking for help from your support system and making those boundaries clear. So like taking care of yourself, because as a healthcare worker, if you're not taking care of yourself, it's really hard to take care of others. So I think those are like some of the best steps to like exercise, getting adequate sleep, making sure you're staying connected. From a patient perspective, just trying to be aware that it's not the healthcare worker's fault, it's like the system itself. So yeah, while physicians and healthcare workers could do all of that, there's also really fundamentally this has to be solved at the institutional and systemic level. There has to be policy changes involved because the reality is, yes, while COVID-19 has exacerbated the situation and the problems in the healthcare system, it's also been a huge learning opportunity to realize and identify what exactly needs to change and what needs to be solved. So I think, Shella, you had a couple of points specifically about some ideas that workers have come up with through conducting various studies.
Yeah, so I think the main things that organizations they must first they must recognize and acknowledge that physician burnout and healthcare worker burnout is a huge crisis and that it threatens the healthcare system as a whole. And I think one of the suggestions they came up with was that we must develop and publicize employee assistance programs that are anonymous and that they're managed by healthcare providers who have experience dealing with burned out physicians.
Yeah, like adding on to that, I know like supervisors themselves, it was mentioned that they all need to be trained at all levels of the healthcare system on how to even recognize burnout. So, because like you might not even be aware you're experiencing burnout. So that's really crucial to ensuring that once it's recognized, it can be addressed immediately and have a positive and an also non-punitive outcome.
Yeah.
I also think that staff, although it's really, really hard because of staffing shortages, but they should utilize their breaks as much as possible and try to prioritize those because they have to prioritize themselves before they can treat and help anyone else.
Yeah, like to not use them to like help patients who are like backlogged, I guess, and like prioritizing their mental health.
Yeah, and also these stress management programs that we've been talking to make sure that they're available all the time, not during off hours, because burnout doesn't affect healthcare workers only during off hours.
And I think like with any solution or like any change you're putting in, they need to have like regular meetings, whether that be with just physicians or like different representatives, each component of the healthcare system, where they're able to talk about just not just the goals and like what's happening, but also like talk about, is the solution working? Can it be modified? Like what can we do to make it better? Because the reality is this is going to take time, but it's through like that constant communication and discourse that we're going to be able to reach an outcome that's like positive and like reach a major change that's going to help burnout not be so prevalent.
Okay, but as an Ontario resident, as like a working person, as a student, etc., like what can I do?
Yeah,
these are all like very big topics that I can't go to a physician and be like, take your break.
Yeah,
what can I do?
I think even we as general, the biggest steps we can take is, as we mentioned before, Bill 124, making sure we sign the petitions so that we can get the Ford government to repeal it. Huge step. And then other than that, like aside from policies, aside from all these changes, just like changing the attitude with what we with which we like approach our healthcare workers, and really keeping in mind what they're going through and that they're here to help us. It's clearly been like absolutely horrendous conditions that they've been working in, and yet they still haven't quit. They're still here for us to take care of us.
Having
Um,
that added layer of compassion and empathy,
yeah,
essentially.
absolutely. Just like greet them with a smile, understand that although I get it, I've been frustrated too with the long wait times and all that, but it's really important to understand it's not their fault and just keep that.
And
And
with
being
that said, oh, sorry, Harini. Did you
I
have
was gonna say, and being thankful for like them continuing to do what they're doing despite the horrible situation.
Yeah, and I was just going to lead into a big thank you to all the healthcare workers, all the physicians, all the nurses, all the housekeeping staff. We thank you for all the time and the energy and the effort that you put, and the fact that you're still here, like, deserves a round of applause. But yes, all your hard work has not just gone to waste. We've all noticed it. We are all very, very thankful, and just keep it up. And that is it for our podcast. Thank you very much for joining us. See you next episode, I guess.
If you are looking to get involved, you can sign many petitions online, including the 4 on the screen. Links will be in the description.